Hello, my name is Diana Brixner. I'm the chair of the Department of Pharmacotherapy, and I'm here to tell you about an exciting program we have for graduate students, a PhD in Pharmacotherapy Outcomes Research and Health Policy. I came to Utah in 2002 as chair of the department and also developed a Pharmacotherapy Outcomes Research Center. We have such opportunities for students in our program, primarily based on a very dynamic faculty that we have, which includes clinical faculty in various different specialties, and then a group of research and tenured faculty that are also practicing in outcomes research areas related to those clinical fields. Thus, it really offers the student a chance to work with the clinical faculty and then take these clinical principles into the research lab, which consists primarily for us of computers with large databases from national, international, and local and regional sources. So this combination really affords a lot of opportunity for the students. Our research faculty have backgrounds in health economics, in pharmacoepidemiology, in quality of life, in statistical analysis, in modeling. So again, you get exposed to all kinds of different aspects of outcomes research and then apply those skill sets directly to clinical settings. It's really a unique experience. Our students go many different places after they graduate. They go on to pursue academic careers as faculty members. Many also go on to pursue a fellowship and then are qualified for positions in the pharmaceutical industry, biotechnology industry, or other technology arenas. It's really a terrific opportunity for these students to have all of these different experiences. I think a real strength of this program is that you're not just learning the skills to do outcomes research. The important aspect is that you're really translating these skills into applied health policy. We have a diverse group of students that come from various different places around the world, and they bring that international expertise, as does the international expertise of our faculty, to look at a true global health policy perspective. When we do the research to evaluate the impact of new technologies on healthcare delivery, we are able to really see it come to life. The research we do on new technologies demonstrates the value those products will bring to healthcare. What benefit will there be to patients, and what will it cost health insurance plans, health policies, regulators, or populations and society to introduce that type of new technology into the healthcare system? So again, our Pharmacotherapy Outcomes Research and Health Policy PhD program is unique, and we look forward to you taking the opportunity to apply and join our team. Thank you.
We have a new PhD program that started with the beginnings of a master's program and has expanded since then.
The goal of the PhD in outcomes research is really to develop independent outcomes researchers as opposed to the MS program, which was really to equip people with the ability to understand outcomes research but not really be independent researchers.
I think we have a very large strength and a set of capabilities in the area of assessing real-world clinical outcomes using secondary data sets or data that were collected for other reasons, such as electronic medical records for caring for patients or claims databases.
We have access and we utilize the electronic health record of university hospital systems. We also have unique connections to look at one of the other major providers of healthcare in the state, and that's with Intermountain Healthcare.
So I think students that are very interested in evaluating large databases to conduct research, interested in being on the cutting edge of integrating different information such as family history and other information that may not be routinely available in your typical commercial databases, the University of Utah offers them a very unique training opportunity.
I think one of the things that differentiates us as a program is the breadth of the faculty and their experiences.
Many of us come from an industry background. So we've come from the pharmaceutical industry, and we have an understanding of the challenges in launching a new product or in revitalizing an existing product.
We have clinical faculty who are generally PharmDs, and they are actually practicing in practice sites around the valley. We also then have research track faculty and tenured track faculty, many of which also have their research programs focused around health economics and outcomes research studies.
And we have health economists, we have economists, we have a political scientist, and so they work together as a team really on projects, but also on committees in the PhD program as well.
With that combination of expertise coming from these different areas, it's an excellent opportunity to help graduate students decide, after they're getting close to the end of their thesis and the potential of having a PhD in pharmacotherapy and health policy, what would be the most appropriate area for them to pursue for a career.
When you're going through pharmacy school, you learn a lot about pharmacology, you learn a lot about therapeutics and how to take care of patients, but in order to be an effective pharmacy leader, you need to know about the economics of healthcare, you need to know about healthcare policy, and all the classes really prepare you and educate you about those kinds of issues.
Because we are an outcomes research center, we're very much involved with training our students in outcomes research and pharmacoeconomic outcomes research, as well as healthcare and general types of outcomes research. And now is a very important time for this because of the initiatives for comparative effects research being supported by the U.S. government.
For instance, we do a number of research projects that are funded through intramural funding grants, and that gives students very much an opportunity to be involved in what it is like and learn what it is like to be an academic researcher in terms of finding funding, identifying appropriate research questions, and et cetera, that would be appropriate in an academic setting. On the other hand, we also do a lot of research that is supported by the pharmaceutical industry with an interest in demonstrating the value of a particular drug or group of drugs, and by experience and opportunities to work firsthand in research projects with the faculty members at PORC, they will also learn what it is like to deal and address research questions that are of interest to the pharmaceutical industry.
You're working on real research projects funded by real companies, asking real questions to make the value proposition, to understand the epidemiology, to understand the progression of disease. And by doing that, the student comes out with a ton of experience that they wouldn't have in other programs.
Every professor helps us to understand literature review and how to write a proposal, analysis plan, and then we have opportunity to join the project. So that's why I can understand what's outcome research more and prepare me to be a leader.
The professors here, they give you a lot of advices to pursuing your future life, and that helps a lot.
See, when I was in India, I was looking for some programs which is related to economic sites in pharmacy. When I was looking at the ranking of the university, and our program is affiliated to School of Pharmacy, which is obviously in a high-ranked university in US. For me, it was priority to go for a university which provides quality of education.
Coming from the University of Utah, I had the opportunity to do 6 weeks at the Pharmacotherapy Outcomes Research Center, and I really liked the types of research they were doing here and how they were impacting even patient care with the research coming out from the center.
If you search on the internet, there's not very much program dealing with pharmaceutical outcomes research, and this is my interest. I want to do something more practice, apply my knowledge of informatics to more practice level, outcomes research and decision making, and this is exactly the program for me.
Utah is a very beautiful place. I mean, if you're looking for natural beauty, scenery, then it's an ideal place for you. And moreover, it's a peaceful place, quite accessible, and its crime rate is very low.
What I love about Utah is the 4 seasons and just the outdoor activities you can do.
If you are an outdoor activity lover, this is a heaven for you. You can ski, you can hiking.
In the winter I go snowboarding, and in the summer I do hiking, I do camping, water skiing, any kind of outdoor activity you can find. I think Utah's great for that because you get the variety with all the different seasons.
All of the schools west of the Mississippi can really offer excellent didactics in health economics, in epidemiology, in research design, in biostatistics, in some of the core classes that you need in order to pursue an outcomes research thesis. What makes our school unique, our department, our Health Sciences Center, is the ability to really apply the research that you develop to real-world clinical practice.
I don't think there's any other program that in the first year has you writing analysis plans, has you writing proposals to do actual studies. Your first month here, you're in the pharmacotherapy outcomes research, working with researchers, sitting in department meetings where we decide the research design and working on real projects.
It's been 3 months I'm here and I'm already involved in a project with one of my professors. So yeah, getting early exposure with the outcome research is obviously better for you.
That kind of experience over the 3 to 5 years or however long it takes to do your degree means that by the time you're done, you'll have worked on 10 probably projects that are real world in nature. The experience is critical to doing what we hope you'll do in your career.